Hello, everybody, and welcome to another Pilates Hour. Super excited today to have a friend, colleague, a thought leader in the industry with us, and that is Wojtek Cackowski. And Wojtek is a physical therapist from Warsaw, Poland, and he has developed a method of Zoga. So good to have you, Wojtek.
Thank you. Thank you for invitation. It's a pleasure to be here with you and looking forward to our discussion today.
Awesome. Now, I guess it was a number of months ago that we had Chase and you on the Polestar Pilates Hour, and I had the chance to get treated by Wojtek in Boston at the National Physical Therapy Association. And so it was a great experience, and I have some great questions for him now that I've felt his hands. I have an idea of how your mind works, Wojtek, and I want to know more. So that's what today is going to be about, is really understanding what you've developed in the Zoga method. While we're getting ready to talk and letting people come on, we have over 5,000 people that have registered for the webinar today. And I've been getting a lot of interest from all over the place asking now, how do I get on to the Polestar Pilates Hour? And if I can't be there live, how do I listen to it? And we try to explain to everybody that it's recorded, and everybody who registers gets a recording of it and the ability to listen to it for the next 30 days or so. And let's go ahead and get started. So first question, Wojtek, is just tell us a little bit about your passion in movement, human movement. Where does that come from? And before we get into the myofascial work and your work with Tom Meyers, where does your passion for movement come from?
Mhm. I think my passion comes from my disability. I had a 30-degree scoliosis in my body. And since being a kid, I didn't feel comfortable inside of my own body. So I was trying to use every possible occasion to move that body and to use it as much as possible, because then movement helped me to feel a little bit more comfortable with the pattern that I was holding. So it started with a need of movement because it gave me some more comfort. And it felt good. When I was in a constant move, I didn't felt my discomfort so much. So most people with scoliosis, they are also they have also a lot of hypermobility around different parts of their body. And once they are static, the being stable, being static, it's very uncomfortable. I remember being a kid, and when you go to a church, for example, and you have to stand for an hour, that hour was always a misery to stand for that long, because after a few minutes, I could hear my knee hurting, my lumbar spine hurting, my shoulder hurting, my neck hurting, and this standing still position was very uncomfortable. So probably this is why, since I was a kid, I was constantly moving and doing multiple different sports, and I was training different disciplines. I was doing karate, basketball, football, ice hockey, everything that I could grasp on that was giving me some movement was something that I felt like this is something that is giving me some benefits. So I was constantly trying to figure out some kind of activity where I could be in a constant move.
Yeah, I think you said something that a lot of kids have in common, and that's that we all start hurting after we've stood in church for an hour.
Yeah.
But
Yeah.
what you're explaining, and I know this is such a deep-rooted philosophy for you, is just the idea of dynamic movement as humans
Mm.
is so crucial to quality of life. And I know
Oh,
when
yeah.
I've had it removed from me for different injuries, you know, psychological, emotional, spiritual things get affected as well. Identity, self-esteem, a lot of things that are affected when we're not able to move in our bodies. Let's talk a little bit about your professional development now. Wojtek, what is sort of your professional curriculum vitae? How did you get interested in physiotherapy? And then from there on with myofascial work, Tom Meyers, yoga, etc.
Mm. It's gonna be kind of the story because my path was very curvy. I had to. I was going through many different stages. So first of all, when I graduated high school, I had no idea what I'm gonna do, as many kids don't have when they finish their high school. So I applied. I was interested in biology, so I applied to biotechnology university. And luckily, I didn't pass that exam, and I didn't get into that uni. And then I was so sure that I'm gonna get to that university that I didn't apply to any other one. So then, when I didn't pass it, there was only this vocational school that was starting in September where I could still apply. And one of the departments in that medical college was physiotherapy. So I was like, let's try this. And it was more a time of my life when being around friends was more important than being in school. So after half a year of not attending my anatomy classes enough, I had this final exam, and I didn't pass that exam. And after half a year, they kicked me out from the school. So, but after this half year, I already started to like physiotherapy. I started to think, oh, this is something that I actually enjoy, and that's something that I would like to do in the future. So when I didn't pass that exam, I felt very frustrated and very angry also, because I really prepared well to pass this exam. I really studied anatomy and I really wanted to pass it, because I, as I said, started to like physiotherapy, and I started to think that this might be my life pathway. So when they failed me, there's another story behind it, but I don't think I'm going to share it now. But I accepted the result of this exam. So I wrote to the Curatory of Education that I do not agree with that exam. And then there was a control from that curatory in the school, and they actually said that I was right, that I should pass this exam. So they made the school to take me back. But because of all that process took about few months, I skipped half a year of that school, and I have to start again from that first semester. And then I came back to that school, but in the meantime, I passed exams to Sport Education University. And at the same time, I had a choice. I either go to Sport Education School, University, or I stay in that college for the physiotherapy. And I just decided to do both. So on the weekends, I was doing the part-time Sport Education University, and over the week I was doing physiotherapy college. And that college was 2.5 years, and then that uni was 3 years. So in that 3-year period, I just graduated from both of these schools. But when I graduated from sport education school, I knew that I don't want to be a sport teacher. I don't want to work in schools. I don't want to either be a trainer for any sport. I already knew that physiotherapy is the thing. So rather than going to a master degree of sport education, I started all over again, new university in physiotherapy, the medical university in Gdańsk. And then I already knew that this is going to be something that I want to do. In the meantime, I was living in Ireland and traveling back and forth to Poland to study physiotherapy. And because I already had a degree from that college and from sport uni, I was able to work as a physio in Ireland, and studying physiotherapy in Poland still at the same time. When I graduated medical school, I found Tom Meyers and structural integration. And then I knew that this is a pathway I want to follow. So I went to UK, and I did structural integration training in UK. I started in 2008 and I graduated in 2010. And when I graduated structural integration training, which was the 600-hour training with Tom Meyers, I started to look at movement and human biomechanics very different than I used to when I was trained in physiotherapy, because in physiotherapy we have had much more localized approach to dealing with symptoms, pain, and problems of the body. So when I came back from that SI training, I knew that there is a very different way of looking at the human body, and I wanted to apply it also differently. I didn't mention before that I also, since 2004, I practiced yoga, which was something that was giving me a good release of my symptoms for a day when I was practicing. So when I was practicing every day, 6 a.m. to 7 a.m., I was practicing my yoga. And then to about afternoon, I was kind of pain-free or not suffering. And then in the evening, the pain was coming back. So then next morning, I was doing my practice again to feel quite okay for another half or 2/3 of the day. And then the pain was coming back. So that was my story for at least 2 years. I was constantly practicing. And then when I went to my structural integration training, because I really wanted to understand the depth of these manual interventions, I decided to stop to do yoga for a year. And because I wanted to see if only these manual manipulations can, without my support of movement, can still help me to get rid of, reduce my symptoms. And to my surprise, about 2-3 months after I graduated from SI and I went through the whole process of structural integration, most of my biggest problems, pains, and aches have either reduced significantly or disappeared. And then for this 1 year, I was just observing my body, how it reacts to a normal day, everyday movement. And I was observing how it's changing because of the interventions that have been done on my body. But then after that year, I decided to come back to my yoga. And when I came back to my yoga, I had a very different sense of what I'm doing in yoga. So every asana had a purpose now. Every asana I could understand biomechanically. So I knew that, in a downward facing dog, I have this knee extension, but ankle dorsiflexion. So I have a maximum pull on my gastrocnemius. And then when I'm doing a slight knee bend, I'm actually slowly reducing tone from my gastrocnemius, but increasing tone into my soleus. So I'm creating the relative shearing between them. And from this time on, this shearing muscle against muscles became my idea fixe. It became something that took my whole gigabytes of my brain to constantly think about what is moving where and to which speed, which direction, what each soft tissue is doing when I'm giving different changes in the position of yoga that I was exploring. So I came back to this yoga with very different understanding, and I started to really try to use yoga to create similar reactions in the tissue that I was creating with my hands. When I graduated SI school, there was 3 SI practitioners in all Poland. So I didn't have, good friend therapists nearby that I could go and say, can you work on my neck or can you work on my shoulder? So that yoga became my treatment. So every yoga session that I was doing for myself was first observing myself, trying to understand the biomechanics that is standing behind my postural patterns. And then in the movement, I was exploring how I can use movement and shearing those tissues against each other to release and change position of my bones. And that was the beginning of Zoga, because when I came back to yoga and I had this different understanding, I was trying to find out how the relationships between different structures are creating a pattern in the body, rather than muscle A or muscle B being short and holding me in that position. So when I started to do cadaver dissections in 2011, and I was moving my cadavers in multiple different ways, I was constantly observing which muscle is doing what and which direction, and how it moves, how it glides, and how keeping them together, not allowing them to glide, how that influences the quality of movement, range of movement, and how the bones are actually, how the trajectory of movement of the bone is happening when this gliding is not free. So that was the really big beginning of Zoga. And at that time, I was not calling this Zoga. I was calling it my structural yoga. And from the structural yoga, from the mistake of presenting this name to someone, name Zoga came about. So I was talking to James Earls, who was a head of Anatomy Trains Europe, and I was typing this on my keyboard, and I pressed Shift and Control at the same time, and I was writing about structural yoga, but he was receiving message of structural Zoga. So when he made a plan of our meeting, he posted Wojtek Zoga, and when I led that class first time in 2015 in Elveden near London, to the other teachers of Anatomy Trains, everybody after that class came to me and said, you know, Wojtek, it's not yoga anymore what you do. So actually, maybe it's a good idea to keep the name. So that was the beginnings of this.
All right. So I was going to ask you on your history, and there's so many things that you and I have in common, but about 2 decades apart. I was just thinking back of how just sort of dealing with your own physical challenges and then realizing how important movement was, getting into physical therapy, but practicing yoga simultaneously, where by the time I got into physical therapy school, I had a dance background, but I discovered Pilates the first year of PT school. And so I had trained simultaneously at St. Francis Hospital in Pilates the same time I was going to physical therapy school. So when I graduated, I never knew a difference, and then continued to move and gain manual therapy skills and delving into the myofascial work as it became more available. I would love to go back. You mentioned something about the way that we were trained in biomechanics, looking at, arthrokinematics and osteokinematics, looking at, levers and ball and joint and fulcrums, to what we're discovering and how we're sort of repositioning the philosophy and science of biomechanics. And if you could, just in a little bit of time, sort of discover some of the big changes that you discovered in your own work and evolution with the structural integration and your experience with Zoga compared to what we learned in PT school.
So I think we have quite a good understanding of arthrokinematics and osteokinematics. We do understand quite a lot on how much translation there is between two joint surfaces, what is the natural physiological movement in every joint and every joint surface. We have quite a good understanding of this, but I don't think we do understand enough about soft tissue movements. We are still in biomechanics thinking about muscles as a pulleys that are creating a pull on a bones that they attach to. But through the knowledge about fascia, we do know now that actually these are the pulleys that create pull on this net that is connecting everything in our body and creates a closed mechanical system. So human body is a closed mechanical system where all the forces that are in that system are interdependent of each other. So every change of tone in one area results in a reorganization of the tone of the whole system. And it's impossible in human body to create a movement with one muscle being active and only this muscle changes its tone. It's impossible. Every time I'm changing a tone of one area of the body, everything is changing and adapting to that tone change. And that change is always happening in relationship to the force that is acting on us constantly, which is the force of gravity. Because we live in gravity fields, so every tone change in one area, so that I'm presenting now, let's say there is something that is happening on this side of my rib cage. If I do this, I still live in the gravity and I want my eyes on the horizon, so I'm going to create another compensation above to keep my eyes leveled. So it's already two areas that are communicating to each other. And then if I go below, there is something here between my ilium and the 12th rib that is compensating this change. And then something on my right hip that is compensating this change, etc., etc. So there is always a reaction of the whole system that tries to adapt to a change that happened in one area to still create an efficient pattern to move and live in gravity. So first of all, different way of thinking about the biomechanics is that whole body always reacts to adapt to the force of gravity. And as Judith Aston is saying, the gravity is our prime mover. The gravity is something that moves us. And our body and our muscles is something that is responding to that force of gravity and tries to negotiate our position in relationship to that gravity field. Of course, there are other forces that are acting on us. This is not only gravity. The second important force is ground reaction force, which is most of the time going in the opposite direction than the gravity. Of course, depending how we hit the ground, if we walk and we heel strike, the ground reaction force is going to go obliquely into our system. It's not going to go up the same way as the gravity is going straight down. So the vectors of the ground reaction force is going to be dependent on, first of all, on the shape of the ground, but also on how our foot lands on the floor. So if I have a foot that is overpronated, that foot is going to take that ground reaction force into the system up differently than the foot that is supinated. So
Appreciate you saying that. I appreciate you saying that because I don't want people to lose the science of physics. And I've heard some of the people in the myofascial world going to an extreme level of saying there's no longer biomechanics. And it's like, we're not saying there's not biomechanics, but I love the approach of whole body and the idea that the internal mechanism is affected with every movement, every load, every displacement, every orientation change with gravity. And this becomes really apparent with something like gait. You know, if we think of just, you know, and I'd love to get your thoughts on this, if we think of just standing tall and we lean forward 5 degrees into the ankles, we can feel the shift through the entire body of how gravity now is wanting to create momentum. So as soon as we feel that shift, all of a sudden we want to be moved by gravity. And now we are accepting and receiving the ground force, creating an elastic force that then keeps us moving in that. And the more that we're angled, the less energy we're spending on pushing off, the more energy we're moving to move the leg forward or to accelerate. And I was reading something about professional sprinters, and we often would think that they need to be somewhere around 17, 18 degrees of inclination to have optimal world-class speed. And Bolt, the world record holder, is somewhere around 21 degrees of his angulation in his acceleration. And to me, it's fascinating because are our tissues trained for the acceleration, deceleration, the tension, compression shifts that are moving our skeleton and all of our organs and our tissues through space in such an elite way just by changing the orientation? Now, most of us lean forward 21 degrees, we fall on our face. We can't get our leg to turn around fast enough. We don't have that reaction speed like Usain Bolt does. But I would love your thought, and we've talked about this a little bit, of just tissue reaction. That we know with the myofascial work that the Golgi organs are just everywhere in our fascial system and primarily responsible for vertical orientation to gravity. So I'd love to think of like just normal human movements and thinking of how you sort of, with your 3D vision, see this full interaction from the deepest organs, the relationships of the fascial connection, the diaphragm, the pelvic floor, the base of the foot, the arch of the foot, the throat. And I know that now, and I'm curious because you treated me for 3.5 hours, and we worked in those areas and facilitated significant change in what was relatively a short period of time. So I'd love to hear your thoughts on that. And by the way, somebody had a question on what type of yoga you practice.
Oh, I started with Iyengar yoga, with Hatha yoga, Iyengar method. I started with Iyengar because it was most precise. And me as a physiotherapist, I really like the preciseness of it. And I like that they say, oh, your foot needs to be this way, this angulation, and then this is going to be. So I really like this. But when I came back from my SI training and I started to explore positions, it developed
Evolved.
to something a little bit more dynamic than Iyengar, but I really like their precision. I didn't like why they not always were able to explain that precision to me because I like to understand. So I wanted to know why you want this angulation like this and not like this. And
You probably had to go
I
back
did
like 5,000 years of experience.
probably.
Somebody, the collective.
Yeah, but this is why in Zoga I really use asanas or postures with a very clear intention on what I want to achieve with that posture. So that's why I wanted to understand in Iyengar yoga what was this, what was the reasons behind every posture and behind every detail about that posture. But coming back to your question on the beginning, I mentioned the gravity and ground reaction force, but there are also forces inside of our body that are transmitted out. And you mentioned already one, the diaphragm. Diaphragm is a muscle that is negotiator of pressure systems, because below the diaphragm, we have a positive pressure of our abdomen, and above the diaphragm, we have a negative pressure of our lungs. And in the mediastinum, we have a heart again that is also pumping the pressure in the whole of our body. So diaphragm is a pressure negotiator, I would call it. And through this negotiation of pressures, these pressures from inside that are influencing tone everywhere outside of our body. So if someone is living with their diaphragm being relaxed all the time, their tone of their body is going to be different to those people who are always breathing in and staying stuck on the inhale. That's going to create a different tone in the overall system because of the pressure difference inside of that system. So pressure systems is another influencer of the mechanics of the outside of the body. And then we have those contractile elements that are also creating forces going inside out to create a pull that is creating a movement that then negotiates our position in space. So as you mentioned, mechanoreceptors are there, and the Golgi are the ones that are sitting mostly on the tendons or the myotendinous junctions. This is where we find them the most. Of course, they are in other parts of the body also, but we also have the Raffini, Pacini, and the interstitial receptors that are located in different parts of our anatomy, like the ligaments and the joint capsules, or the Raffini more in the epimysiums of the muscles, or the interstitial receptors that are more in the interstitial spaces, or the loose connective tissue. So all of them are like as sensors that are sensing and giving the information to the nervous system of how the different elements of our architecture are either compressed or toned through our relationship with gravity. So human body always is negotiating, and as we mentioned on the beginning, change in one part of the body always creates some adaptations and compensations in other parts of the body. But I like to say that every compensation has a price. So of course, human body has I won't say endless, because it is, and there is an end to these compensations, but multiple ways of compensating disorders in the body. So if you sprain your ankle and you have injured the ligaments on the outside of your ankle, between the fibula, between your calcaneus and the talus, and the talus shifts to one side and rotates and stays like this after that injury, you're going to put the pressure on that foot differently, and that usually creates overpronation or lateral rotation of the tibia and the internal rotation of the femur as a compensation of this foot not being aligned after the injury. And of course, we can live like this. We can live with the laterally rotated tibia in relationship to the femur. But we know that if your tibia moves out, if your tibia and the femur, if they do this, so let's say this is my tibial tuberosity, and I move it like this, can you see that now my patellar tendon is going to be shifted off to the outside? And now when I'm going to bend my knee, that patella is going to be dragged on the lateral condyle, which is then, after a certain period of time, it's going to create chondromalacia of the patella. So that's the price. We can live like that. We can even enjoy sport for a certain period of time. We can load it for a certain period of time. But when we overload this shearing element, they're going to create inflammation and pain. Right. So
and
compensations.
You know my body to some extent, and you know that because of, and this was what I found interesting, the ankle injury was first, the lateral fracture of the ankle 40 years ago, and staying so active for so many years, even pole vaulting in my late 40s, but realizing the effect it had on the hips and now eventually the knee because of the compensations. And even with Pilates and gyrotonic and the physical therapy, it's finally caught up, and it's like now exploring some of those really deep relationships of how things like flexor hallucis longus tendon and how the soleus and how the flexor digitorum and these muscles are impacted by the foot placement or the modification of the foot placement from the injury
Yeah.
and creating that abnormal rotation in a prolonged period of time that now has led to some pretty serious deficiencies. And then realizing when we pay attention to that and re-educate that, so playing with the foot proprioception and playing with isolated and integrated movements of the toe and the foot and the midfoot are actually changing the relationship of the tibia with the femur and vice versa. So these are the things that I wanted the audience today to listen to and realize it really is an endless study for us. And
Yeah.
there is an end, as you said, because the body is finite. But if you think more of a Feldenkrais way of how many degrees of freedom do we have to achieve that movement, right? How many variations of that movement could still be considered normal? And sometimes in our practice, we become so rigid in thinking that all movement has to happen this way, getting up off of the ground, or how we squat down to the ground, or how we jump or climb a tree. And so I would love for you to talk a little bit more about the versatility and I guess, almost endless capacity we have to explore movement. Like when we look at the martial arts or Ido Portal or Roya Gold or parkour, and we look at these incredible interpretations of human movement through space, and how is it that we move ourselves towards there to have the greatest degrees of freedom of solving our movement challenges? And then bring that into a therapeutic population like you have with children that have cranial deformities, spinal deformities, neurological dysfunctions that you're seeing in your practice, Wojtek, some pretty significant outcomes that a lot of physical therapists and movement teachers are not even able to conceive or perceive. And I see people already asking, hey, how do I get experience with Zoga? We're going to talk about that later. But we've got about 15 more minutes, and I'd love this to be sort of the topic that you bring to the table in physical therapy and movement science.
So in Zoga, I'm, like you mentioned first, this amazing movers, and I'm not gonna even try to do what they do with their body. I have a quite mobile body, but my major focus in creating Zoga was not to create best movers on the planet. Probably my first goal was to create normal movers, so people who still have ability to move their body like we all did, or most of us did when we've been kids. So if you look like on a kid up to age, let's say 5 or 6, they can use their body. Most of healthy kids, they can use their body wherever they want. Whatever the idea is, what they want to do with their body, they can do it. So crumbling around, rolling, jumping, and inverting, all of
Splits.
that. All of this movement is available in their system. And I say that you can say that their system has multiple options for movement. And more options for movement you have, the more compensation possibilities you have, the more of distribution of forces is happening in your system. So when you meet some force that is meeting your system, you can distribute this force and not to get injured. if you have little options for movement and you meet some force that is going into your system, it's going to be stopped somewhere. And the area where that force is going to be stopped is where you're going to get an injury. So
and that's a basic Polestar. It's written on our t-shirts, it's everywhere, but distribution of movement equals distribution of force. And we discovered that years ago, just realizing 2-3 more movement options in the thoracic spine can significantly reduce what people are experiencing in L4, L5, or L5S1, or in their cervical spine or their shoulder, just by adding a few more. And you think about it, if you strategize to move from 3 out of 24 segments, and now your soft tissues are sort of set with that, yeah, we're going to hurt ourselves in those segments when we meet that force.
Exactly.
And you think of a kid that can absorb huge forces because it distributes through all 23, 24 segments. Yeah, I dream of that.
Yeah. And even more to that, they still have a cranium that is still growing. So even if they hit their head, there's multiple ways how that head can go around those
The sutures aren't
sutures
fixed.
and take that force, and has nothing, no concussion, no reaction, nothing. And when adult person is going to hit that same force in their head, it's going to be broken.
Closed head injury. Yeah.
It's going to be brain injury, severe situation. So for that options for movement, in Zoga, I look at this through a lens of options for movement between all the anatomical structures. So we know all from anatomy, we all have learned some anatomy, some more, some less, but we all learned some anatomy. And we know from anatomy that, first of all, muscles have a different shapes. Yeah, we have a triangular muscles, we have a quadrate muscles, we have a fusiform muscles that are more like a sausages with tendon and a tendon on both ends. We have a pinnet muscles that have a tendon and the fibers that are going into the tendon. So we have a different shapes. And when the skeleton and those attachments of those shapes to the bones are moving, every shape is going to create a different shape changes when it is pulled. So when I pull on the fusiform muscle, this sausage is getting more thin but longer. Yeah, and when it contracts, it gets wider but shorter. Yeah, so that's the biomechanical reaction of the soft tissue of the fusiform muscle. But when you create a contraction in a pinnet muscle, it's very different. It's mostly tendon that is standing up, but the muscle is not changing its shape so much. It's not changing volume so much because there are multiple fibers going into the same tendon. So it's very different mechanical reaction. And then you have these flat muscles that are just shearing like this and being pulled like this, or like a sartorius that is like a thin strap. So that thin strap is going to move along the adductors that underneath them need to create a rolling movement. So because of the different shapes and because every muscle is attaching to a different point on skeleton, when the skeleton starts to move, all of those structures need to, like my hands now, they need to create those individual shearing movements. And in many areas, the direction of fibers of one muscle to a next muscle that is just next to it, they go in a very different direction. So they need to create also, this kind of motions. And if because of lack of movement, injury, or inflammation, or a scarring, or injury that I had, if those structures have adhered to each other because of the inflammatory process, now when I pull one, can you see that this one is going to be pulled and twisted with it?
That's
and then
such a good image, by the way. I just want to reiterate, when we as Pilates teachers and physiotherapists and yoga teachers, if we can understand what Wojtek just explained, and we see this all the time, especially in older adults or young adults that have been involved in heavy sports and maybe some injuries, and we don't think about the ability for the shearing and the different levels of the muscles. And I think that's what I felt in your treatment. It's what I felt, from a very light feathering over the scar to some very deep bone translations and tissue translations, and looking at how do we restore that? How do we get that moving again? And I want to finish up where you're looking at how Zoga, you have two components to it. You have the manual therapy component, but also more importantly, the movement practitioner component to it. Can you explain that a little bit as we move through that?
Yes, so there is a Zoga therapy and Zoga practice. Zoga therapy is a combination of movement and touch. And the Zoga practice is only for a movement people who do not have a license to touch. So those people are using very precise lead movement and movement cueing and guiding movement to create an effect that we are gaining also through manual interventions. But I think the way we do this, I already explained how the muscles are shearing. So imagine if there is this adhesion between two structures. In Zoga, I'm understanding the anatomy of these movements, and I'm creating a pull in one of the structures, like I'm creating a pull here, and then I'm initiating movement of the one that is next to it, and I'm slowly shearing it against each other until it gets free. So this is basically the idea that stands behind every movement protocol that we are doing in Zoga. We are creating pull in one area, and then we are moving structures around it to free them up from those adhered relationships. And maybe it's going to be very good way to, because I've seen some comments, how can we experience Zoga? And I think we can talk about this later also, where we could organize a webinar with some movement, actually not only talking, and then people can experience more. But I can lead you through a very simple sequence for the hand, okay? Because sitting like this, everybody's going to be able to do this. So first, just close your palms, open your palms, and maybe do a few movements with your wrist, and just notice which left wrist and palm feels a little bit more stiff. Which do you feel it's maybe not that free to move? If you found one, then take that hand, okay? And first, we're just going to take the hand like this into extension. And now I'm going to start with pulling on my fingers, and I'm going to create a lot of extension like this. Okay, I'm holding this extension, so all the tendons that are going through the wrist canal are going to be tensioned, and very often those tendons get adhered to the thenar muscles. So let's start like this, and first just do big broad movement of your thumb. And you're gonna feel how those adhesions are slowly breaking, and you can feel a little burning maybe, a little discomfort where you move your thumb, but actually after a few movements, you might feel that, oh, it's getting a little easier. Let's change direction now, opposite direction, and explore all the edges of movement, how far I can reach everywhere, how far out, how far up, how far in. Okay. All right, thumb is done. Now, grab this thumb from underneath like this, yeah? Now bring the thumb towards the dorsal portion of your forearm, and now close and open the rest of the fingers.
I hope you're all doing this at home. I can't see you, but I hope you're doing it.
Me too. Okay, a few movements like this. Now open, and now take your fingers together and out. And now just scratch gently the ends of the fingers. Now the deep flexor, the deepest layer is moving now, yeah? Okay, and now grab the middle finger, this, and now close the rest of the fingers while holding this one.
Ooh.
And most of people gonna have a difficulty to do this because the superficial and the deep flexors for most people are like one muscle. not multiple fibers responsible for multiple fingers. So this is going to be an interesting experience. Now grab the another one. Like this. Now maybe to make it more fun, take it above your head and do the same thing. And open the rest of the fingers. So we are still closing and opening, closing and opening. Okay. Now take the pointing finger and now try the same thing, but behind your back. So pointing finger extended, and now the rest of the fingers are closing and opening. So we are creating different tone relationships of the shoulders into the wrist, and each of those relationships is evoking different reactions in the fingers, finger flexors. Okay, and the little finger, the last one, again, close and open.
Ooh. Oh my gosh.
Oh, someone have a trouble with the ulnar nerve. Okay.
Oh, that's a good one. I'm going to do that one every day.
Okay, great. And now after this few simple basic movement, just close and open your palm. Do this movement and just notice how you feel that hand. So we have been sharing this epimnesiums on epimnesiums, perimnesiums against perimnesiums, and all of this. And we are creating, we know from science that these shearing movements are producing hyaluronic acid, which is soaking up water into the space between the tissues. So they get separated and they are more glidey. When they become more glidey, we feel it as a more freedom, more fluidity of movement. And we also know that there is a lot of mechanoreceptors and nerve endings in those areas. So we also have a better sense of that sensation of that movement. So this is a basic idea that stands behind every movement we do in Zoga, and one day we can do a little more. And maybe
I'm so glad you did that. I really am. I wanted people to feel that idea of, you know, when you talk about how some of the restrictions with the tissues and the layers that often get restricted, and just think of our sedentary lifestyle, you know, how we compress and bunch things up in the front of our hips or the front of our chest or in our jaw and our neck and our arms. And then we go do Pilates or we go play volleyball or we go running, and those tissues aren't gliding and sliding the way they should. And so we have tissue damage and inflammation and irritation that we're dealing with. I would love, we're going to do this. So Wojtek and I have been talking that we're going to try to organize some kind of retreat on the farm with Wojtek and have it both from the Zoga, learning for both types of practitioners, but also experiential and then explorative of looking at how can we enhance our Pilates training by incorporating a deeper knowledge of anatomy, myofascial tissue layers, the integrated system of our anatomy, and really incorporate it into our practice so that we are doing exercises with very clear intention of being able to free up these different layers and understanding how our exercises can do that. So this is really good stuff. I see Chase doing a lot of promotion in the Chase is our biggest cheerleader, and we love you, Chase. Listen, we are at the end of our time. There was a question from Diane Rowe asking about some of the other, I guess, talking about some of the other mechanoreceptors. And there's a bunch of them. And as Wojtek mentioned, they're in all different tissues of our body to be able to give us sensory and sensation, proprioception, body awareness. Some are related to stretch, some are compression, some are tenderness or pressure. So a lot of different things that give us awareness of who we are, where we are, including our eyes and our inner ears and jaw space. So a lot of cool stuff. All right. Well, listen, we got a couple things to announce. One, we're going to put any of Wojtek, anything on your website. We'll post on the post-production, any courses you have coming up, retreats. I would love to hear from you in the audience if you would love to join us for a retreat on the farm for a couple days and do something with Wojtek in maybe the next 6 to 12 months that we set up a time, give you a chance to get here. Let us know if you're interested. And then we will look at maybe setting up a virtual webinar with you that might just be a course that we set up for like a 2 or 3 hour webinar that we can do with the Polestar crowd. So if you'd be interested in that out in the audience, let me know. Lastly, we have 2 really cool things on the docket just to announce. I'm being reminded that we have the Franklin retreat that's going to be at the very end of May, beginning of June for 4 days. So if you haven't looked at that, that's going to be a once-in-a-lifetime event. We brought Eric to the United States for his formal training over 20 years ago. And of course, many of us have incorporated Eric Franklin's imagery and dynamic imagery. So we're excited to have 4 days with Eric on the farm, and it's going to be more than just training. It'll be celebrating and a retreat, relaxing, moving, outdoors, indoors, all kinds of fun stuff. We'll break bread together. We'll dance together in the evening, maybe a good bonfire that we can dance around. But that's going to be at the end of May, beginning of June. That's going to happen here in North Carolina in the Raleigh-Durham area. I will be in Phoenix for the Pilates on Tour with Bounce Body in April in a couple weeks towards the end of the month. So if you are going there, check us out. I'll be doing a pre-conference with Victor with the Connect method, and then also doing an introduction to critical reasoning and the keynote address for that particular conference. So we hope to see you. Definitely see you at the Pilates Hour. I can't thank you enough, Wojtek. I'm super excited about your work. I look forward to introducing it into the Pilates and Polestar community. I think it's going to be a huge asset for us. And we'll get more Wojtek and the Polestar family soon. So we'll be talking about it.
Thank you so much.
Polestar's goal is to bring the world physical, emotional, and spiritual alignment. Wojtek definitely fits all 3 of those. So thank you, Wojtek, for being with us. And above all things, everybody, remember to be kind. Thank you.
Yes. Wonderful. Thank you so much. Thank you for the invitation, and thank you for this hour.
Anytime, Wojtek. Have a good week, everybody.